Welcome back. This is Gateway 101. In today's live broadcast, we're going to be treating a very interesting topic. We're going to be treating a very interesting topic. Okay? Do not forget that whatever we're doing Gateway 101, we are only trying to create healthcare awareness. That's exactly what we're doing Gateway 101. So, we're going to be talking about H. pylori. H. pylori is a bacteria, so we'll talk much about it today. And then do not forget, we always believe that prevention is better than cure. So if you have an issue, having any medical issue, we strongly encourage you to go and see your doctor. So whatever we do in Gateway 101 does not constitute diagnosis, either does it constitute treatment. It's purely health care awareness, and we also provide some simple home remedy to help alleviate illnesses. So without wasting much time today, we'll be talking about H. pylori. H. pylori is a short for Helicobacter pylori. It's a type of bacteria that affects the stomach. It's one of the most common causes of stomach-related problems worldwide. So it is a very, very common bacteria. So think of it as a germ, 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 that can live in the stomach lining and slowly cause irritation over time. So what does H. pylori do? H. pylori can damage the protective lining of the stomach and lead to chronic gastritis, that is stomach inflammation. Do not forget that H. pylori is a very, very stubborn bacteria that live in the stomach. Okay, so with over time, it can cause a lot of damage to the stomach. Okay, so sto- H. pylori can damage the protective lining of the stomach and leads to peptic ulcer, that is sore in the stomach or small intestine. It is a very, very stubborn and brutal bacteria. In some long-term cases, it may increase risk of stomach cancer. Yeah, in some long-term cases, H. pylori may increase the risk of stomach cancer if not properly treated. Okay, so please try to subscribe to Gateway 101. This is Gateway 101. Please subscribe and like. Subscribe and like. So, in how do how do people get H. pylori? Is spread merely through contaminated food or water. So H. pylori, do not forget, is a bacteria that live in the stomach. And how do people contact it? People contact H. pylori through contaminated food or water. Please do not forget to subscribe, very important, okay? And also poor hand hygiene. Close contact, that is saliva or shared utensils. Please subscribe and like. Subscribe and like. Subscribe and like. Thank you. The good Lord bless you. So close contact, saliva and shared utensils. Many people get infected in childhood without realizing it. Common symptom of H. pylori infection. Some people have no symptom at all, but others may experience burning or growing stomach pain. Others will experience bloating or excessive bumping. Some people may experience nausea, vomiting. Okay, some may experience loss of appetite, unexplained weight loss, feeling full quickly, symptom of ulcer, pain worsening on an empty stomach. That is H. pylori for you. How is H. pylori diagnosed? Doctor can test for it using breath test, very common. The breath test is a very common test that is used to detect H. pylori. Stool antigen test is another test again. Blood test less accurate for active infection. So please kindly subscribe and like. Subscribe and like. Subscribe and like. And the good Lord will bless you. So we're talking about H. pylori. Okay. So other tests may be endoscopy with biopsy if ulcer is suspected. Okay, so treatment. H. pylori is usually treated with a combination of two biotics. A proton inhibitor (PPI) to reduce stomach acid, and treatment usually lasts 10 to 16 weeks. So when should you see a medical doctor if you're having H. pylori? When should you see your medical doctor? We say that seek medical care immediately if you have severe or persistent stomach pain. Okay, do not forget it is because this bacteria live in your stomach. So you have tried and it's still persistent, severe or persistent stomach pain. Seek a medical help immediately. Vomiting blood, you need to seek medical help immediately. Black tarry stool, you need to seek medical help immediately. Unexplained weight loss, seek medical help immediately. Difficulty swallowing, please seek medical help immediately. Okay, so for the sake of you who are just joining us, let's go through the whole thing all together again for the sake of you who are joining. Okay, we were saying that H. pylori is a short for Helicobacter pylori. It is a type of bacteria that infects the stomach. It's one of the most common causes of stomach-related problems worldwide, the H. pylori. So think of it as a gram that can live as a germ that can live in the stomach lining and slowly cause damage over a long time. So what does H. pylori do? We say that H. pylori can damage the protective lining of the stomach and lead to chronic gastritis, stomach inflammation. It can also cause peptic ulcer, which is known as sore in the stomach or small intestine. In some long-term case, it may increase the risk of stomach cancer. We said that before. So how do people get H. pylori? This is very important. It's spread mainly through contaminated food or water. Okay, poor hand hygiene can also cause H. pylori. Close contact, saliva, and shared utilities can also cause H. pylori. Many people get infected in shower without realizing it. Common symptom of H. pylori infection. Some people have no symptom at all, but others may experience burning or growing stomach pain. Others may experience bloating or excessive bumping, nausea and vomiting, loss of appetite, unexplained weight loss, feeling full quickly. Example of ulcer, pain worsening on an empty stomach. So H. pylori has symptom of ulcer. Okay, so how is H. pylori diagnosed? Doctor can test for using breath test. stomach antigen and stool antigen test. Blood test less accurate for vital infection. So treatment for H. pylori will be doctor normally put treatment usually with a combination of 2 antibiotics. Okay, so 1, 2 gonna be antibiotics, 3 gonna be a proton pump, inhaler to reduce stomach acid. Treatment usually lasts 10 to 14 days. So when should you see a doctor? See a doctor immediately when with your severe or persistent stomach pain. Seek medical doctor. Vomiting blood. Seek medical help immediately. Black terrace stool. Unexplained weight loss. Difficulty swelling. Please seek medical help immediately. So it's like I said, it's going to be a very short broadcast, but it's very, very loaded. Okay, so to come your way again the same time next week, this is Gateway 101, and thank you for following us. Bye for now.